Can I ask a dumb one?
Are you going to ask a dumb person or are you going to ask a dumb question? Maybe both, maybe neither. It's kind of it's like kind of Russian roulette of personal finance question asking.
You really got to stop calling our audience dumb. This
We,
is getting out of control.
yeah. Well, we don't know yet. We don't know what the question is, but the questions are never dumb.
Okay, this question is from Shannon. Shannon, thank you for writing in. You did a really good job at making your question nice and succinct. We appreciate that. People are getting better. We didn't have to edit this one. So Shannon asks, my question is about early retirement and health insurance. Although Marketplace exists for now, it seems employer associated policies are much more extensive in coverage and, of course, more affordable. Is early retirement realistic in a country with such expensive healthcare costs? What options do early retirees have?
Good question. Thank you, Shannon. So there could be an entire podcast about navigating the healthcare and health insurance system. And so I'm going to start with a caveat that I'm not going to solve health insurance for you right now, but I think I can at least tell you my perspective on how you could potentially retire in this health insurance world we live in. First, it is kind of weird in America that health insurance is so tied to your employer and whether or not they choose to offer health insurance and what health insurance they choose to offer. Other countries aren't like this. It is kind of strange that if you switch jobs that you won't be able to go to the doctor. That seems like a wild thing to me. And so I think decoupling your health insurance from your employer isn't necessarily the worst thing in the world. Another thing is you mentioned that employer-sponsored health insurance policies are generally better or more extensive than the Affordable Care Act. And I don't think that's necessarily true. Employers generally don't get some crazy deep discount on some much better policy. I think they generally are navigating a very similar market to you are if you go and try to buy a policy directly. Of course, they can negotiate a deal with the health insurance provider if you have a big group, but that's essentially what the Affordable Care Act is negotiating with the healthcare providers for the biggest group, like all of Americans. And so it just feels a lot cheaper and maybe more safe as an employee because your employer is paying a lot for it. So, for example, you might go and pay $1,000 a month for a health insurance premium if you go buy it directly. But if your employer buys that exact same policy, they might just decide to pay 80% of it for you. So they're writing the check of $800 a month or $9,600 a year for you, leaving you to only pay $200. So $200 a month versus $1,000 a month sounds amazing, and it is, but it's really just essentially coming out of your salary. So, for example, if the employer had $90,000 of budget to hire you and they put $10,000 of it towards your health insurance, then your salary is going to end up being $80,000, right? And so it feels a little bit better because it just is happening behind the scenes and you just see what you see, which is your end of the day salary. But it's not magic. It's just the employer paying it. So that said, what do you do if you're faced with this $1,000 a month premium? And I'll tell you what I do, which is I just buy it. I went to healthcare.gov. This is .gov shout out day at a personal finance club show.
We love the government.
Yeah, I know. This is a government episode. But I went to healthcare.gov and you can search based on your state. For me, I'm in California, so actually I think it redirected me to covered California. For your state, it might be different. Then you can see all the prices, you can put in your details. And for all of its failings, the Affordable Care Act did some nice things. One, it gave you guaranteed coverage, so you can't be denied. Before the Affordable Care Act, if you had a pre-existing condition, you were just out of luck. You would just be left to die or go bankrupt or whatever. It's guaranteed to cover essential healthcare, things like hospitalization, prescription, maternity, mental health. There's income-based subsidies. And so that's one option that you might have as an early retiree. If you retire and your income goes to zero, then you could potentially get the Affordable Care Act health insurance for close to zero. I am an early retiree, but I just have so many investments and money out there doing stuff. I didn't even really bother trying to get the subsidy, to be transparent. And I feel like maybe it's not really in the spirit of the rule to have a wealthy person like myself try to not pay the insurance premium.
Right.
So I just pay it. When I was single, paying just for my own, it was around $400 a month. Now I have a family of 4. It's around $1,500 a month, which is an eye-watering amount of money. But things cost money. You're going to need a certain amount of money to live, whether it's $40,000, $50,000, $60,000, $70,000, you might need to dedicate $10,000 a year to covering your health insurance premium. And that just needs to go into the calculation of when can you retire. So if you're trying to, get your investments to generate $50,000 a year and you haven't accounted for health insurance yet, maybe it needs to be $60,000 a year. It's not good news, but it's not impossible, right? It's just a different number. So, and the other nice thing, I didn't finish this list about the Affordable Care Act, is that there's an annual out-of-pocket limit, meaning in the early days, when I used to buy health insurance for myself pre-ACA, the insurance would cover you up to $1 million or something. So if you get cancer or hit by a bus or something horrible, you might go to the hospital in the ICU and burn through $1 million of coverage in a week or two, or however fast it happens. And then beyond that, the health insurance just stops paying. They're like, we did our job. There's your $1 million. Now you're on your own. Now there's an out-of-pocket max, which is and for us, for an individual, it might be like $8,000 a year, or I think for a family, it's like $16,000 a year, something like that, which is obviously a lot of money, but it's not millions of dollars that you're on the hook for indefinitely because you got a very serious illness. It's just a reasonable amount of money. And so again, as an early retiree, you might have an HSA or a high yield savings account or an emergency fund where you can cover your annual out-of-pocket max if you need to, and then still be able to kind of rest easy knowing that a serious illness or injury or whatever isn't going to literally bankrupt you and drain your retirement. It's just your insurance covers it now. So as expensive as it is, that's what you're getting for. You're getting that insurance, and that's kind of what insurance is for the big bad thing happening. So, apologies on behalf of the health insurance world because it is a gigantic mess, but it's really not that hard to go to healthcare.gov, buy one. It's just kind of expensive.
Yeah. Interesting takes. I think that we can all agree that insurance is just very confusing. I actually have insurance through SAG.
Oh, that's awesome.
Because I write music, and sometimes that music goes into commercials, and sometimes those commercials are union. And so I made enough money to qualify for that, and it's pretty affordable. But my best friend works for one of the big insurance companies. I won't say which one, but even when I ask her, she's confused. So knowing somebody who's been in this industry for 5 years at that company and still has questions, and sometimes calls me to ask questions about the laws in California, because she'll be serving people in California. She's a social worker. I'm like, the fact that you have to call me, a layman, and ask about what the laws are in California, it's not readily available, tells you how confusing insurance is. So I think that, like you said, the research is available for you. You just have to kind of do the work and try your best to get the plan that's best for you.
Yeah. It's rough out there. And don't feel dumb because, like you said, nobody understands this stuff, and we're just all trying to do our best. And it's just incomprehensibly confusing, and this is covered and this isn't. And, my general strategy is I generally go for the lowest premium. I try to pay the least out of pocket I can. Yeah. And the difference in your out of pocket max doesn't change that much, if at all. And so you're still on the hook. You have to pay more throughout the year, for appointments or whatever. But I'd rather just keep the money in my own account. I use an HSA, a health savings account, to put any extra money I have to cover those medical expenses beneath the out of pocket max. And then beyond that, that's when the insurance kicks in. So.
Yeah, like you said, it's for the just in case. 'Cause I feel like I'm a relatively, knock wood, healthy person, and so I don't generally use my insurance a lot. So it's just making sure that nothing crazy happens, because medical debt stinks.
Yeah. Let's never speak of health insurance again. I hate it.
Okay. I don't know. We might get more questions.